Hi guys, let's check together the bleeding control ways before obturation of root canal.
Hello. Let's see another case. So these patients referred to me today for retreatment of 44. The patient came to me with pain. He had the pain for 4 days, continuous pain, and he take a lot of painkiller. So when he came, I informed the patient that I don't know what is inside. The success rate of treatment is around 60%. I'm not sure that we can do everything perfectly, we can reach to the total working length. And I don't know is there any broken file inside or not. But I informed the patient about it. And patient accepted to try to save it. So I did the retreatment. It takes around 1 hour from beginning to the end in one session. But let's see the result. Okay, and I will tell you about the process. Okay, so yeah, this is the result, guys. Could you see? When I opened the tooth, when I did the access cavity, I recognized that the other doctor couldn't find the lingual channel. So I tried to open it, and successfully I opened it till the physiological problem. Could you see the curve at the end? Yeah. And could you see the infection? It's exactly under the opening of channel. Could you see exactly it's under it? So in this case, even I could do just selective retreatment. I could just clean this channel and leave it because it's completely clean. There is no any bacteria, or I don't know, there is no infection. The reason of pain and the reason of infection is the lingual. So I could do the selective retreatment, but I did the normal retreatment. I removed the gutta perca from buccal one as well, and I did the filling again. So I did the normal retreatment, not the selective one. But could you see the infection? And there was an interesting thing. When I reached to the total working length here, I did the ProTaper, okay, ProTaper Gold. After the S2, I had the bleeding. I have active bleeding, really active bleeding from the infection side. So I did the instrumentation until F2, okay, and after F2 I tried to wash it with sodium hypochlorite 5%. I tried to wash it with it continuously, but even after complete instrumentation and irrigation, the bleeding didn't stop. So in this case, I have two strategies. Okay, the first one is to put the paper point. There is a true strategy. Put the paper point on the channel for 20 seconds and push it. Okay, and I always use the paper point one size bigger than the last file. Okay, so for example, if I did F2, I use 30 paper point, 30. If I did F3, so I'm using 40 paper points or 35. So always one size, two size bigger. Okay, because if you use the, for example, 25, maybe your paper points go to the infected side and it will increase the bleeding. It will increase it. It won't help us to stop it. It increases it. Okay, that's why I always use one size bigger. Okay, I push it, I take it for 20 seconds, and then I will take it out. Okay, I try it, it didn't work, there was a bleeding. Okay, the second strategy is use the cold spray on paper point. Okay, I push the paper point with cold spray into the file. Again, I leave it for 20-30 seconds. I remove it, there was a bleeding. Again, I try the cold spray on paper point and then put the paper point in root canal. Again, bleeding. So I did the last strategy, and the third one, this one, the viscostat clear, guys, the clear, not the normal viscostat, because the normal viscostat, it's there is a brownish color. Okay, it can cause discoloration. Okay, and cleaning of this color, it's very hard. Okay, so you have to use viscostat clear. Okay, this is paper point, for example. Okay, the assistant put just one drop, really one drop of viscostat on my glove or on the paper, and then with paper point, the tip of the paper point, just the tip of paper point, I will soak it with viscostat. Okay, so the tip of the paper point is soaked by viscostat clear. What size of paper point? One size bigger, guys. Okay, we don't want to go inside infection. Don't go inside. Okay, so with viscostat and one size bigger paper point, I went to the root canal and I leave it for 20 seconds. And when I remove the paper point, there was no bleeding. There was no bleeding. Okay, and everything was dry. Again, after it, I wash with 5% sodium hypochlorite, and then normal saline, and finally chlorhexidine. And after the chlorhexidine, I started drying by paper point, and it dried. Everything was dry. Just take care. Take care. If you are using viscostat, you have to stay in root canal by your paper point, because if your paper point goes to the infection, you can push viscostat clear to periapical area and it will irritate the patient. Maybe after it, patients have a bit sensitivity for a couple of days. Okay, because it's like a foreign body. Okay, it's not very biocompatible. Okay, take care, don't push it to periapical. That's why always you have to use one size bigger paper points. Okay, always one size. Or if you don't have a confidence to go with paper points, so use two size bigger. Okay, so use two size bigger to make sure that you will stay in root canal and you are not going to periapical. Okay, so I informed the patient that after the root canal treatment, I will do the filling, and after 1 month, we will check. If everything is fine, you have to put the crown on these tooth, because there was huge filling. There was a huge filling, and this is the second time that we are drilling, we are touching the root canal, and the tooth is weaker and weaker. So I think the crown in this case is the best option. By the way, let's see the results, and I will post the results maybe next year. Okay guys, see you.
And don't forget to subscribe us.